Hello, everyone. My name is Dr. Pragyan Acharya, and I'm an additional professor of biochemistry at All India Institute of Medical Sciences, New Delhi. My project was on gender medicine, the influence of gender on various aspects of diseases, such as chronic diseases, autoimmune diseases, pain perception, etc. Everyone knows that gender-specific diseases exist, like prostate cancer, which is specific to males, X-linked color blindness, which is very frequent in males, and ovarian cancer that occurs exclusively in women. But do other diseases have gender-based differences? Do men and women experience the same disease differently? These are the questions that gender medicine explores. There is an overwhelming amount of scientific evidence that suggests that yes, women experience pain differently compared to men. Women manifest diseases with different degrees of severity compared to men, and women are more prone to autoimmune diseases as compared to men. Yet, these factors rarely figure in the medical management of diseases. Our lab at AIIMS New Delhi works on the area of liver and kidney dysfunction. And when we applied the concepts of gender medicine to our work and our data, we made some very interesting observations. Let me share them with you. In order to diagnose liver and kidney diseases, when a patient goes to a clinic or a diagnostic center, they typically give a blood sample for testing of something known as protein biomarkers. So you might have heard of liver function tests, kidney function tests, etc. They essentially look for a specific protein in your blood. We work to develop more sensitive tests to be able to detect these organ dysfunctions early. This will allow you to prevent organ dysfunctions early enough by diagnosing them early. When we looked at some of the protein markers of liver and kidney function that we were working with and stratified them based on gender, to our surprise, we found that most of these biomarkers, which are readily detectable in males, here in blue, were present at very low levels in females, here in red. What does this mean? This means that diagnosing organ dysfunction in women may be harder than in men, and that women may need more active screening and more sensitive biomarkers, probably even new ones, to be discovered in women. This also implies that therapeutic strategies may also need gender-based fine-tuning. And this has opened up a new area of research and given a future direction to our work in our laboratory. The WomenLift Health leadership journey has been an enriching experience for me. Using the concepts of authentic leadership, which I learned about with the help of my peers, mentors, and coaches in the WomenLift Health program, I established this leadership project idea and fine-tuned it extensively. This was quite a challenging experience because as a basic scientist, we are not trained to think in terms of the influence of gender on cellular function or biomarker discovery or therapeutic effect. And I have applied this to my own research in liver and kidney dysfunction and obtained a deeper insight and a way forward. Concepts of inclusive leadership forced me to think about how gender might influence the fundamental functioning of the human body. And I connected with and learned from many colleagues in the field of gender medicine and palliative care. Strategic leadership concepts have helped me develop a vision for myself because the program emphasizes the development of a vision. And I learned to connect with like-minded colleagues and senior leaders to affect change. The concepts of impactful leadership has influenced me, and I'm now committed to developing others and building a positive, empowering community around myself. And I'm very interested in manifesting the vision that I have developed for myself through the WomenLift Health program. And needless to say, we have been receiving immense support from our peers in the WomenLift Health program cohort, mentors and coaches throughout this journey, and I've made some lifelong friends as well. With this, I come to the conclusion of my presentation, and I thank you for your time and attention.